Hey guys, so in this video lecture, we're going to be covering chapter 24. It's going to go over the infections of the central nervous system. So we're going to look at the basic components of the central nervous system as well as specific diseases, their causative agents, their hallmark presentations, and as well as some treatment plans if necessary. So let's go ahead and get started. So what is the central nervous system? So the central nervous system is divided, or the nervous system itself is actually divided into two. So one is known as the central, which is what we're going to be focusing on, and then the other one is called peripheral. So the central nervous system is the one that controls and coordinates everything. So this is your brain and spinal cord. Whereas your peripheral nervous system, this is the one that will collect and transmit data from the body. So these are like your spinal nerves and your neurons. And then your neurons, there are two different types. There's sensory and motor. So sensory is the one that sends signals from the sensors in the peripheral nervous system to the CNS. So it goes from outermost to innermost, so to your computer, essentially, like your brain. And then motor neurons are the ones that actually come from your brain to your extremities. So an example would be of sensory neuron working is that if you were to touch something cold and then your brain is just like, oh, that is cold. Or motor is where like, oh, I need to pick up my phone. So your brain will tell your hand how to move so you can pick up your phone. So that's the big picture. So this is the overall view of your nervous system. So your central nervous system is like up here in your head, and then your peripheral nervous system is everywhere else, far and distal from your brain. Okay, so one more thing that we're going to talk about in terms of anatomy is going to be the meninges and the blood-brain barrier. So the meninges are three layers that protect our brain and our spinal cord. So there are three layers to the meninges. There's the dura mater, arachnoid mater, and then pia mater. So the dura mater is the outer, the arachnoid mater is the middlemost. This is the one that will actually contain our cerebral spinal fluid. And then the pia mater is the innermost, closest to the brain tissue. And then the brain-blood barrier, this is where all the capillaries are very, very selective to what can go in and out of the brain. I do have a video, I showed it in class, that goes over the blood-brain barrier a little bit more in detail, but the big picture from the video is that we have a lot of parameters in place in order to protect our brain from pathogens, essentially. And the big things are those endothelial cells as well as tight junctions. That's pretty much all I want you to know in terms of the blood-brain barrier, but definitely take a look at that video. It's very, very informative and very, very quick and easy. Okay, so general symptoms. This is a very broad list of symptoms that you will get if you actually have an infection of your nervous system. So almost all infections for the central nervous system will have fever, headache, and a stiff neck, and a lot of times followed with nausea and vomiting. If it continues, a lot of times you can have convulsions, but not with all of them. But for the most part, you could slip into a coma, and then that coma can lead to death, depending on what infection. And then also, if you slip into a coma, sometimes you may not be able to breathe on your own. And if that's the case, you may have to be put on a ventilator. If you're not treated quick enough, death may occur. Also, with a lot of these infections, you can do a relatively routine diagnostic test. It's called a spinal tap, which is where you are collecting cerebral spinal fluid. So you can do that for bacterial, for viral, as well as fungal. But the easiest one to tell whether or not if you have a bacterial or a viral infection is with cerebral spinal fluid. You can also test for it with fungal, but with that one you need to do additional testing. You can't just tell by looking. So with with the spinal tap, what you'll do is that you'll have your patient curl up in a ball, so you can somewhat expose, you can separate some of the vertebrae, and then what they will do is that they'll go in, put the needle into your spine, and will collect fluid. They'll let the fluid flow out, and then sometimes based on just looking at it, you can tell whether if you have bacterial, viral, or fungal, mainly between bacterial and viral. So with bacterial, what will happen is that instead of that spinal fluid being clear, it will be cloudy. And then with that, the doctors may be like, okay, we need to start them on broad spectrum, and then they'll send off the fluid for more testing in order to do a sensitivity test in order to better know what medication will treat the infection. Now, if you have a viral infection, then it will be clear, and a lot of times you'll just do supportive care. You won't actually put them like on antivirals or anything. You'll probably just put them on maybe like a muscle relaxer, and then some anti-nausea, and then maybe some high dose of Tylenol in order to help with the fever, and then maybe pain medication depending on the patient's condition. Okay, so a general overview of all CNS diseases is that they will almost always never start from going directly to the central nervous system, meaning that a lot of times if you're going to have an infection of your CNS, it's because there is other tissue that were actually infected prior to the CNS. So for the most part, what will happen is that there will be other tissue, so you'll have an infection somewhere else in your body, and then that infection will disseminate or spread to the CNS, causing an infection in the CNS. Or it was because of proximity. So meaning you had an infection, let's say, in your eye or in your ears, and then it traveled to the brain, because they are very, very close, and they do share some commonalities in like transportation, such as like blood vessels, nerves, and so on. Very, very rarely does it actually start in the central nervous system. But some common signs and symptoms will almost always be headache, dizziness, fatigue, nausea, and stiff neck. Almost always. A lot of times they'll present as like flu-like symptoms, so a lot of times CNS infections can be misdiagnosed, and then that can actually be very, very detrimental to your patient. And then also determining the pathogen can be difficult because we can't just go in and take a biopsy of the brain or of the sinus area, and then or from the spine, because it can be very traumatic to the patient. And then also it's not good to go cutting your brain and then opening up your spinal cord. Those are probably the two most sensitive areas of our body where you don't want to go in and disrupt other than the heart. So it can be very, very difficult to diagnose, to determine what pathogen is actually causing our infection. Okay, so different types of CNS infections. These are the main ones. We're primarily going to focus on the first two. So the first one is meningitis. So this is where there is an infection as well as inflammation of the meninges, and this will cause a headache, fever, and confusion. So confusion can range from multiple things. It can be confusion as to like whereabouts, who they are, also lack of time, or just where they are saying things that don't make sense to their surroundings. So like if you were talking about a dog and then all of a sudden they start talking about grass. So that is what confusion entails. It kind of varies between patients. And then we have encephalitis, which is an infection and inflammation of the actual brain. So this will cause cognitive decline as well as sensory decline and motor function decline. And then there's two different types of encephalitis. There's primary, meaning the microbe is directly affecting the brain. And then there's secondary, meaning that encephalitis came secondary to already a primary infection. So meaning the microbe spread to the brain tissue. Okay. And then we have, I believe you pronounce it radiculitis. Can't even say it. So this is inflammation of your spinal nerve roots. So this is where your nerves actually exit your vertebrae. So if we go back to our picture, so like we have our spinal column in the center. So where those like little dots are, that is the opening of our vertebrae that actually allow our neurons to travel out to our body into our distal part of our bodies. So that is where the infection will occur, is at the base where the nerve travels out of the vertebrae. We're not going to talk too much about that because it's not very common. And then we have meningitis encephalitis. So this is inflammation of the meninges and of the brain at the same time. And then we have myelitis. So this is inflammation of the spinal cord only. So that's just some basic terminology. Like I said, we're primarily going to focus on the first two, and then we'll dabble a little bit in the fourth one. Okay, so let's talk about some symptoms of encephalitis. So these are very broad symptoms. Every infection is different, but generally this is what will present almost every single time. So what will happen is that if encephalitis is present or occurring, a lot of times your patient will report numbness or tingling, prickling sensation in their extremities, like in their fingertips and their toes and the feet. And then they can have extreme sensitivity depending on what, but for the most part, it's extreme sensitivity to light, so photophobia, or sometimes they even report having sensitivity to sounds. And then we have absence of reflexes, so meaning that they will not react like normal. So, like whenever you were a kid, the doctor would always do that little tapping thing on your knee to see if your leg, the bottom part of your leg, would kick. If encephalitis is present, a lot of times patients will not, they will not have that reflex. And then there's also some mental state decline, so like some confusion. Temperament can also change, so they can be extremely depressed or extremely angered at the slightest little thing. So a person's, I don't say personality, but their mood can definitely be an indicator that something is going on with their brain. Now with viral infections, so viral infections, you can also use cerebral spinal fluid to test for presence if it's virally. But what would happen is that you would still have to do a spinal tap to collect the fluid. And then what will happen is that if the doctor sees that it is clear, he might send it off to be like, hey, can you test to see if there's excessive lymphocytes? And if there are lymphocytes present in the CNF, I'm sorry, CS, CSF in the fluid, then he would probably be like, okay, there is viral infection going on. We're just gonna do supportive care. So some maybe like Tylenol to help with the fever, pain medication depending on patient, and then maybe some fluid replacement, and then anti-nausea medication. For the most part, it's just supportive care, and it's self-resolving. So it's not it can be considered a medical emergency, but if your patient is going to get a infection of the nervous system, you want to hope for viral, mainly because they have a higher likelihood of surviving. Now, if it's bacterial, fungal, or parasitic, that is where it can be definitely more of a medical emergency, especially bacterial and fungal. With these three infection types, there are high presence of white blood cells in the cerebral spinal fluid. It's not as common compared to viral infections, but they are definitely much more severe. Also, if you have a bacterial infection, you can treat with antibiotics, but it can be very hard because a lot of antibiotics can't penetrate the blood-brain barrier. Same thing with antifungals. Also with antifungals, they are extremely toxic to your patient. They work very, very well, antifungal medications, but like I said, they're extremely toxic. They have a high toxicity rate, especially on the kidneys. So your patient can actually go into kidney failure because of the medication that they're taking to try to save their life. But overall, the best preventative is vaccinations, but with some of these, there are not vaccinations available. Okay, so let's talk about some viral encephalitis, and the primary one that we're going to focus on is rabies. So rabies is a zoonotic disease, so meaning that it's also in animals as well as humans. So what will happen is that the human will come in contact with the virus normally through an animal bite, and then what will happen is that the virus will replicate within the nerves, and then eventually it will travel up the nerves to the CNS. So it's transmitted through, like I said, through bite wounds via saliva. So there are virions inside the saliva, and then the saliva gets into the wound, and then it will replicate and disseminate to the CNS. General symptoms for humans, it normally takes about 2 to 3 months for it to become apparent. Normally, there's some neurological symptoms, and a lot of times at that point, the patient will start seeking medical attention. They won't go right away because they don't see any symptoms. But the symptoms that will happen is that there will be some, muscle spasms of the mouth and pharynx, and then eventually what will happen is that as the disease progresses, hydrophobia will set in, so the patient will become very, very dehydrated because they can't swallow, or anything that comes in contact with the mouth causes the patient to severely gag and have excessive salivation. So that is what that foaminess is, because they are so dehydrated. So the mouth will start foaming and creating all that saliva, and eventually they can't even swallow their saliva because of the muscle spasms in their mouth and pharynx. So it's a very, very harsh disease. That's why whenever you think you've been exposed to rabies, you go directly to the doctor to get a shot, and that shot will actually increase your mortality rate very, very significantly. So there are 3 forms of rabies. There's the furious one, which is the one that is aggressive and they may bite, and hydrophobia is present, so meaning that they quote unquote don't like water and they can't swallow it. And then we have the paralytic, which is where you have the weakness in limbs and then you're unaware of your surroundings, so you're very, very confused. And then you have the atypical, so this is where you have the neuropathic pain. So like you will have, even though you are not being like hit or anything or stabbed, you have this severe sensation in your nerves that causes a lot of pain. And then a lot of times what will happen is that you'll have abnormal movement within the area of where the wound occurred. So if you got bit, let's say on your arm, then that arm that was bitten will have abnormal movements. And then with that, a lot of times you'll slip into a coma and then unfortunately will die. Treatment for rabies, most humans don't get the rabies vaccination, although it is present. A lot of times, some people will get it because they work with animals or they work with wildlife. But most people, they don't get it. A lot of times treatment is because of after being exposed to it. So this is the vaccine plus the immunoglobulin that will actually help fight off the infection, the virus, the immunoglobulin. So most people, they just get the treatment because of being exposed. But sometimes due to occupational hazards, a lot of times people may opt to get the vaccines. Like if you work like vets, also wildlife management, they may get it. But for the most part, you just get it treated, and then if you do suspect that you have been exposed, definitely seek sooner. It's always better to get a shot rather than passing away from a very curable infection. So I do have a video embedded in the PowerPoint if you want to see how rabies actually present. Fair warning, it is a very, very graphic video, and the music does not help. It's very ominous, but I did show it in class. But if you want to watch it again, it's definitely there at your pleasure. Okay, so let's talk about mosquito-borne encephalitis. I don't know too much about these, but I do just want you to know how is it transmitted for the most part. So we have the Eastern Asquarian encephalitis. So this is transmitted from bird to bird via mosquitoes. And then it can spread to horses through mosquito bites. And then with humans being around horses that are getting bit, then those mosquitoes around the horses can also infect human. It's extremely rare. Um, that's it is treatable, but there is a high fatality rate, meaning that you can die from this infection. But like I said, it's very, very rare. And then we have the West Nile encephalitis. So this is also transmitted in the bird population as well. Most people who get infected don't actually develop the disease, which is good. But if you do develop the disease, a lot of times it will present flu-like, so meaning you'll have flu-like symptoms like the nausea, the headache, the fever, and maybe some chills. That's all I want you to know about it. Nothing too fancy. Okay, let's continue on with some viral and then we'll go into some bacterial stuff. So viral meningitis, like I said, it's not as severe or as high of a medical emergency as bacterial meningitis. Um, a lot of times, if meningitis is suspected, a spinal tap will be done. And a lot of times that fluid is clear, so the patient, not the patient, the doctor will just do supportive care, and then that will be good. Now we have poliomyelitis. So this is extremely contagious. It is transmitted through the oral fecal route or directly from person to person. Most patients are asymptomatic, meaning that they don't show any signs of ailment. But there are two different types. There is the non-paralytic or the symptomatic. So the non-paralytic form of the disease is generally characterized with fever, malaise, meaning general weakness, muscle aches, and then it can go into meningitis if not resolved, meaning your body doesn't clear the infection or you don't seek treatment. And then there's that 1% where patients are symptomatic and it can cause paralysis. And then if paralysis sets in, then there are destruction to neurons, primarily motor neurons, and that can lead to long-term deficits or disabilities. Okay, so that's all I'm going to say about viral CNS infections. So now we are going to go to bacterial. So this is the more common stuff. This is the medical emergency where the patient needs to be treated right away because death can occur. But just like all the other meningitis, you will see the fever, the headache, as well as stiff neck. A lot of times, if you suspect bacterial meningitis, what you'll do is that you'll actually have the patient try to move their neck either from side to side or their chin to chest. If your patient is unable to do that, you need to order a spinal tap as soon as possible and start them on broad spectrum antibiotics. So once a spinal tap is ordered, a lot of times you will see that it's very cloudy, which can also confirm the fact that you need to put your patient on antibiotics. In order to prevent bacterial meningitis, there are vaccinations against it. So even though you have the vaccination, you can still develop bacterial meningitis, but the rate of death is significantly decreased. So within the vaccine, it does protect against three pathogens that normally do cause it. The first one is strep pneumoniae, and then N. menedicinus, I can't even say it, and then H. influenza type B. So each of these is kind of grouped in accordance to age. So with the first one, a lot of times that's kind of like the broad spectrum where it's kind of fair game for any age group. Whereas the second one is mainly around the college age. So like high school to first undergrads, so like around 24-ish. And then the last one is primarily with children. So age group can also kind of help you narrow down as to which one, but for the most part, it's going to be the children and young adults that get it. Not so much if you're like in your 30s to 50s, but then the elderly population. So that's also why high school and college requires you to have this meningitis vaccination, because it does reduce the amount of outbreaks as well as reduce mortality, and then also can reduce transmission rates. Okay, so let's talk about meningococcal meningitis. So this one specifically is caused by N. meningococci. That is the gram-negative bacterium. It is a normal mucosal pathogen, so it does reside in our throat, but it does spread very, very quickly from person to person contact or coming in contact with contaminated fomites. So that is why this one can actually spread very, very easily through like a school, because it's close quarters, and then also like sometimes people will share drinks, share food, um, ladies share makeup, although um, it's more common to spread among the girls because girls tend to be a little bit more readily um, to share things. Although it can definitely be a male, there's no discrepancy in terms of gender. But what makes this specific meningitis very virulent is the fact that it does have that typhoid pili, which aids in adhering and invading epithelial cells, and with that, it can easily pass the blood-brain barrier. Sometimes the strand that causes this meningitis, it can result in these purple rashes, which we can see right here. So that's only if an endotoxin is produced. Not all strands produce an endotoxin, but a good majority of them do. There is a vaccine against this, and it is definitely recommended for college students. So this is the one that we specifically get whenever you enter college at a certain age. Okay, so let's talk about neonate meningitis real quick, and then we will talk about other bacterial infections. So neonate meningitis, this happens whenever a newborn is less than a week old. This is because during vaginal delivery, the mother had the normal bacteria found in the vaginal secretion, and then the baby was delivered vaginally, and a lot of times will pick up the bacteria and it doesn't have any immunity against it. So a lot of times it's caused by E. coli or Streptococcus type B. But it is treatable, but it can also be very deadly, especially since it is a neonate, so they are very fragile in terms of immune system. So generally, neonate meningitis will happen during vaginal delivery. The baby will acquire the bacteria that way, not so much because of it being nosocomial. Okay, so with that, let's talk about botulism and then some tetanus. So botulism is caused by Clostridium botulinum. Sorry. It's normally a foodborne pathogen, so it's commonly associated with vegetables and honey. And also the fact that it is associated with honey, that's actually why you don't want to feed babies honey at the time whenever they're young, because they haven't developed their immune system yet. But once they get to a certain age, their immune system is a little bit more robust, and then they can have honey, which is why adults or teenagers, they can have honey and not get sick because we have an immune system or immunity towards it. But what will happen is that if botulism is present, it's actually not the bacteria that actually hurts you, it's the toxin that is produced that hurts you. So that toxin, it will cause paralysis, and that paralysis generally starts in the face, and then it can spread to the limbs. And then if it reaches breathing muscles, so at that time point where it's in the face and in the limbs, if it's not treated right away, it can go to the breathing muscles, and then that can actually lead to respiratory failure, which can go to death. So the reason this toxin is so deadly is because it blocks acetylcholine from being released to your neurons, so to your like muscles, so neuron to muscle. So blocks the release of acetylcholine. To treat botulism, what you'll do is that you'll actually produce an not produce, you'll be given an antitoxin. So this antitoxin, it actually doesn't reverse what has already been done. What it does, it will prevent more toxin causing more issues so your body can slowly recover. Prevention for botulism is that if it's foodborne, you need to make sure that proper canning is being done. So meaning if you're like canning your own food, which is perfectly fine, you need to make sure that when you're canning it, it's in an acidic environment. Or what you do is that whenever you're canning, you boil it and make sure that internal temperature reaches a certain temperature in order to prevent Clostridium from surviving. Also, what you can do is that you can add nitrates to your food, so Clostridium cannot produce any endospores, spores. So that's the big thing for botulism. There is a video I do have embedded. Definitely take a look, but it pretty much goes over what we just talked about. Okay, so let's talk about tetanus really quick. So tetanus, it is a very painful disease. It is caused also by Clostridium species, particularly the Clostridium tetani. So what happens is that when the bacteria invades the body, they will produce a toxin as well that will cause very, very painful muscle contractions. So generally what will happen is that the first sign of tetanus is something called lockjaw. So this is where your jaw will lock up and it's not movable. It's very, very painful. So it will cause muscles in the person's neck and jaw to be constricted, essentially. So making it hard for the mouth to open and to swallow. It is considered a medical emergency. So what will happen is that you'll seek medical help, hopefully, and then you will be treated with medication, specifically a tetanus immunoglobulin. And then if you have tetanus because of a wound, then you'll have wound care as well. And then the doctor can also give you some medications to aid in muscle spasms, so like muscle relaxers, and then antibiotics to treat the actual tetanus bacteria, and then they'll probably give you the vaccine as well. So the vaccine is actually a great way to prevent tetanus. And then it is recommended to get a booster just so you always have that slight immunity every 10 years. But the big thing with tetanus is that it releases a toxin, and that toxin causes a downstream effect with your causing essentially muscle contractions. Okay. So there is a video that does go over what we just talked about. I like it. I thought it was pretty cool. It's from PBS. I thought PBS always makes stuff very, very simple. So definitely take a look at that to aid in your studying. Okay, so let's talk about some fungal infections, and then we'll talk about a prion disease, and then we will be done. So fungal infections are my favorite. So fungal infections, kind of just like with all the other infections, they normally don't cause the only infection. A lot of times a fungal infection of the CNS will happen because primary infection disseminated from somewhere else in the body. And generally a fungal infection of the CNS only affects immunocompromised patients or somebody who underwent a neurological surgery. So immunocompromised primarily in the HIV/AIDS population, but also as well as cancer patients, anybody who has an autoimmune disease, diabetes. So any underlying disease or medical condition can increase somebody's risk of developing a fungal infection of the CNS, just like with any other infection, whether it be bacterial, viral, or parasitic, same thing. But generally with fungal infection, it will only happen in the immunocompromised population. So there are 3 fungal infections that we're going to talk about. So the first one is going to be Candida meningitis. So this is the most common one that you'll see of the CNS caused by a fungus. So generally what will happen is that you'll have a Candida infection somewhere else, and then it will disseminate to the brain, and then it will cause brain abscess and then also meningitis. So you can diagnose this using a spinal tap as well. You'll test specifically for, if I remember correctly, I don't remember. You'll you'll do a spinal tap and then you'll send it off for testing, kind of just with all the other ones. Um, all fungal meningitises, they are considered deadly if not treated correctly and quickly. So with Candida meningitis, you want to definitely make sure that you're treating it with specific antifungal medications that are susceptible to Candida, or Candida is susceptible to, I'm sorry. Okay, so then we have cocci-meningitis. So coccidial meningitis, it is caused by the coccidioid species. So these species are found in the environment, primarily in the dry desert soils. So a lot of times, what will happen is that cocci can spread very, very easily because of windy conditions, and the spores are in the wind, and then somebody will inhale it. So a lot of times, a patient will get a cocci infection and it will present as pneumonia. But a lot of times it can be misdiagnosed or mistreated, and then with that, it can disseminate and cause meningitis. General hallmarks of cocci meningitis are the headaches, the blurry vision, stiff neck, but then as well as decline in cognition, and then hearing changes, and then some neurological deficits as well. And then you do want to treat this because it can be considered a medical emergency. Okay, so Cryptococcus, in my opinion, he is the most deadly of them all as compared to the two other ones. So Cryptococcus, he is also found in the environment, primarily in bird droppings. So with that, it can be found in the soil, so in the environment. But generally, he doesn't cause any issues in healthy patients in terms of meningitis. He can cause disease in non-immunocompromised patients, but generally, it's almost always immunocompromised patients. But with Cryptococcus meningitis encephalitis, he will invade the brainstem, the meninges, the cerebellum, and the cortex of the brain. So it's very, very rare, but if somebody has Cryptococcus meningococcal encephalitis, it is extremely deadly and it will kill your patient very, very quickly if it's not caught. So, like I said, it is rare, but it's rapid. And then, if it continues to cause infection, your patient will slip into a coma. And then, unfortunately, at that point, a lot of times death will happen. But general symptoms of Cryptococcus is of course, the headache, severe headache, and then cerebral edema, so swelling, which is where the encephalitis will set in. And then, if untreated, it is almost 100% fatal. So you definitely want to keep an eye out for that, so your patient doesn't pass away. But it will present the same, where it has the fever, stiff neck, nausea, vomiting, photophobia, so sensitivity to light, and then confusion. And then here are some pictures. So the first one is of the abscesses I was talking about that are present in the brain, primarily with Candida as well as the coccidioides. And then this is a stain of Cryptococcus in right here. So this one, the reason why Cryptococcus is more difficult to treat compared to the other ones is because you see this halo around it. He has a capsule around him, so that actually protects him and then also allows him to avoid detection of our immune system. So that's a virulence factor of Cryptococcus. So it's very hard for antifungal medications to penetrate, and it makes it more difficult for our immune system to detect. Okay, so let's talk about one more infection. So we're going to talk about prion disease and then we are going to be done. I don't know a lot about prion diseases other than this slide, so I'm not going to drill you too hard on prions, but essentially what is happening whenever you get a prion disease, prion, it will actually destroy a specific protein in your brain, and then by it destroying the protein, it's actually degrading its function and degrading its structure. And with degrading its function and structure, your protein is not working, and then it will cause these accumulated structures called amyloids, and then with that it can actually lead to um, destruction of brain tissue, and then with destruction of brain tissue, unfortunately, you will die from a prion disease. And then with brain tissue being destroyed, you'll lose motor function, sensory function. You'll have some neurological decline or deficits from the disease. There is a video that goes slightly more into detail about that, but the biggest thing on prions is that I want you to know that it's not curable. So what prion disease is that it will um, interact with certain proteins, and then it will misfold the protein, causing it to decline in function and structure. And then with the decline in function and structure of the misfolded proteins, it will lead to neurological decline, motor decline, and sensory decline, and then eventually death. Okay, so with that, that will wrap up our lecture. So we talked about basic anatomy of the nervous system, various infections, so the viral, bacterial, fungal, and the prion disease. So I do want you to know causative agents, hallmark symptoms, treatments, and then possible prevention measures if mentioned for each disease type that we talked about. So if y'all have any questions, definitely don't be afraid to contact. Thank you for staying around and listening. I'll see y'all in class.